My beloveds, your question on the board exam, big board exam, and it's a gynecologic tests, means diagnostic tests and procedures. Okay, let's go. So gynecologic diagnostic tests and procedures are essential for evaluate female, of course, reproductive health. These tests help in diagnosing infections, structural abnormalities, hormonal imbalances, and malignancies. Medical students must be familiar with indications, techniques, interpretations, and potential complications of this test to confidently not only answer board exam questions, but know it in future practice. Doesn't matter what specialty we'll choose. We have to know that. So, a pelvic examination. So, we start, of course, always with non-invasive techniques. What is this? Non-invasive techniques. This is, first of all, manual pelvic examination, performed using speculum to visualize cervix and vagina, and bimanual examination to assess uterus and indexa. Indications: routing screening, abnormal bleeding, pelvic oral pain, vaginal discharge. So my key exam tip for you: always explain the procedure to the patient before starting. Remember that, because of course, on the MCQ test will not be answered about you will not be asked about that, but on oral exam, absolutely. So because it's oral exam, you have to always explain the procedure to the patient before starting. It doesn't matter, it's a gynecology, my cardiology, or something else. Always explain the procedure, aim of the procedure, the goal of the procedure, purpose to the patient before starting. Okay? Then, pap smear. Actually, now it's highly controversial, but anyway, pap smear is one of the base of gynecology. Papa Nicolau testing and HPV testing. What is the purpose of pap smear? So, detect cervical dysplasia and HPV infection, a major risk factor for cervical cancer, they said. Guidelines start at age 21 and then every 3 years if normal. So co-testing with HPV starts at 30, repeated every 5 years if normal. Between us it's a fraud, but you don't answer in this manner. Huh? Anyway, so interpretations. We have ASQS, repeat PAP of HPV, ASQS, abbreviation. So repeat PAP of HPV testing, LCL, colposcopy if more than 25 years, and HCIL, colposcopy and positive biopsy. Contraindications: acute vaginal infection, because it may affect results. Key exam tip: most common cause of cervical cancer, HPV 16, HPV 18. Okay, this is a theory, of course. Ultrasound then, transabdominal and transvaginal. Indications: assess of ovarian cysts, fibroids, endometrial thickness. Evaluate early pregnancy. Monitor ovulation. In infertility workup. Key exam tip: best initial imaging for pelvic pathology, transvaginal, ultrasound, TVUS. Best initial imaging for pelvic pathology. No, if it's not a virgin, of course. Transvaginal, ultrasound, TVUS. Invasive diagnostic techniques, colposcopy and cervical biopsy. Purpose: detailed examination of the cervix using acetic acid. White lesions suggest dysplasia. Indications: abnormal pap smear, types of biopsy, punch biopsy, endocervical curettage, ECC, endocervical curettage. What about contraindications? Acute cervicitis, delayed biopsy is present. Key exam tip: gold standard for diagnosing cervical dysplasia, colposcopy with biopsy. Remember that. That's why I said take your pens and papers, my beloveds. Endometrial biopsy, EMB. Purpose, evaluate endometrial hyperplasia or cancer. Indications, postmenopausal bleeding, women more than 45 years with abnormal uterine bleeding, persistent anovulation, PCOS, obesity. Okay? Okay, so contraindications. Pregnancy, cervical stenosis. Contraindications, pregnancy and cervical stenosis. So key exam tip. First test for postmenopausal bleeding is TVOS. I repeat, it's transvaginal ultrasound. So first test for postmenopausal bleeding, TVOS, if endometrial thickness more than 4 millimeters, EMB. Then hysteroscopy. Purpose, the direct visualization of the endometrial cavity. Indications, abnormal uterine bleeding, endometrial polyps, fibroids, recurrent miscarriage evaluation. So purpose of hysteroscopy, direct visualization of the endometrial cavity. Indications, abnormal uterine bleeding, endometrial polyps, fibroids, recurrent miscarriage evaluation. So key exam tip, definitive diagnostic test for intrauterine pathology. Question, what is definitive diagnostic test for intrauterine pathology? It's hysteroscopy. Laparoscopy, purpose, minimal invasive surgery to evaluate pelvic pain, infertility, endometriosis, or ovarian masses. What about indications? Chronic pelvic pain, endometriosis, tubal ligation, sterilization, unexplained infertility. Contraindications, hemodynamic instability, known for emergency ectopic pregnancy rupture. Okay, so laparoscopy purpose, minimal invasive surgery to evaluate why not pelvic pain, infertility, endometriosis, or ovarian masses. Indications, chronic pelvic pain, endometriosis, tubal ligation, so-called sterilization, unexplained infertility. So contraindications is a hemodynamic instability, of course. Key exam tip, gold standard for diagnosing endometriosis is a laparoscopy with biopsy. With biopsy. No, biopsy always, the last point. What else we have? Hysterosalpingography. HSG. Hysterosalpingography. Hysterosalpingography purpose, evaluate fallopian tube. But that's why it's the name. Tube patency, infertility. Indications, suspected tubal blockage, recurrent pregnant loss. That's why it's hysterosalpingography. Recurrent pregnancy loss. Contraindications, active pelvic inflammation disease. PID, active pelvic inflammation disease. So key exam tip, classical finding of tubal occlusion, spillage of contrast absent. So I give you, take your pens and papers. Let's talk about, key points. So test, indication, and key findings. Pap smear, to remember. Indications, cervical cancer screening. What key findings? SCQS, ASCUS, LSIL, HSIL. This is a pap smear. Colposcopy, indications, abnormal pap smear. Key findings, acetowhite lesions. Colposcopy, indications, abnormal, colposcopy, yes, once again, I said, colposcopy, abnormal pap smear, and key findings, acetowhite lesions. Endometrial biopsy, AUB, postmenopausal bleeding. Key findings, endometrial hyperplasia, cancer. Hysteroscopy, polyps, fibroids, adhesions. This is indication. These are indications. Key findings, direct visualization. Laparoscopy, indications, endometriosis, infertility. Key findings, so-called chocolate cysts, endometriosis, during laparoscopy. HSG is the hysterosalpingography, indications tubal patency in infertility, patent, no? Normal. Tubal patency in infertility, and key findings, blocked tubes. What do we see? No contrast spillage. No spillage. So that's it. Oh, that's all, folks. Largely sufficient for your excellent mark on a big board exams. My beloveds,